What's INR? So INR is International Normalized Ratio, and it was created as a way to be able to track and see how oral anticoagulants were affecting our clotting cascade and seeing how it was affecting our patients and their anticoagulation. So this was devised because before PT was measured, since warfarin affects PT, heparin affects APTT, so it was measured as a way to kind of track and monitor how our patients were doing. And they were using PT, but the problem with that was depending on the laboratory, it wasn't easy to compare because of like the type of exams that they used. It might have been off, and so it was hard to compare between laboratories to laboratories, and we definitely couldn't have, done countries to countries unless maybe they were using the same laboratory exams. So this posed a problem, and in order to get rid of this problem, in 1983, they came out with INR, and INR is a measurement of PT. So what it does is it uses PT, but it takes it a step further to standardize it. And so the formula for this, not that you really need this, is INR is PT test of the patient that you take over PT control, and that's an average of like 20 healthy patients taken to the power of ISI, and that's a numerical value comparing like your normal commercialized laboratory systems to international values. That way it just normalizes it. And so INR is a great way to be able to track your patients, be able to compare them between cities, different laboratories, different countries. And so it's a measurement of PT, oral coagulations, and seeing how our patients are doing with their anticoagulation. So a normal patient should have an INR of about 1. If you have a patient with PE or atrial fibrillation, the INR should be between 2 to 3. And if you have a patient with mechanical heart valves, that should be even higher, like 3 to 4. So thank you, and now you know what INR is.